Okay, so let's get right into it. Today, we need to talk about dementia. It's one of the biggest, most daunting health challenges we're facing globally. And the numbers, they're truly massive. But what's really interesting is that a clear, compassionate roadmap for better care, it actually already exists. So we're going to look at the scale of the problem and then explore this surprisingly practical path forward.
So let's start with this number, 49 million. Just try to let that sink in for a second. That's how many people aged 65 and over were living with dementia across the globe back in 2021. That's not just a statistic, you know? That's millions upon millions of families, friends, and communities all navigating this incredibly tough journey.
And here's the kicker. This problem isn't standing still. Not even close. The truly staggering part is the speed of this change, a 160% increase in just 30 years. That tells us we're not just dealing with a large number. We're dealing with a rapidly accelerating crisis that our healthcare systems are frankly scrambling to keep up with. And this chart, wow, this really just puts that growth into sharp perspective, doesn't it? Back in 1991, we were looking at about 18.7 million cases. You fast forward just 3 decades to 2021, and we're at 49 million. The visual contrast here, it just drives home the urgency and the incredible human scale of what we're all facing.
So it's one thing to count cases, but how do we even begin to measure the human cost? Well, that's where this concept comes in. It's called disability-adjusted life years, or DALYs for short. It's basically a way to measure all the years lost to poor health, to disability, or to an early death. And in 2021 alone, dementia was responsible for over 25 million of these lost years. It's just a powerful way to quantify that profound loss of time and of a quality of life.
But of course, behind all this data, behind every single number, there are people. And this quote, it just cuts right to the heart of the experience. That feeling of being completely lost after a diagnosis, that's a huge part of the problem we have to solve, not just for the person with dementia, but for everyone who loves them. So that brings us to the crucial question, right? We see the scale of the problem. We can feel the human impact. So what can we actually do? Where do we even start to look for a better path forward? Well, here's the hopeful part. It turns out a practical blueprint really does exist. And it's not some abstract futuristic idea. It's a real-world, actionable report from a group in Washington state called the Dr. Robert Breeza Collaborative. They got doctors, patients, caregivers, everyone, in a room together to create this incredible roadmap for how to do dementia care better.
And the brilliance of this report is really in its structure. It's built around these 6 fundamental pillars. It all starts with a dignified and early diagnosis. Then it moves to ongoing care and support, and that's for the patient and their family. It puts a huge emphasis on advanced care planning, so future wishes are clear. It helps people plan for needing higher levels of care, and then it gets super practical, focusing on how to prepare for hospitalization and how to screen for things like delirium risk. It's just a totally comprehensive approach that covers the whole journey.
This slide really captures the huge shift in mindset the report is calling for. On the left, you've got the way things usually are, right? Totally reactive. A problem only gets addressed when it becomes a crisis. But on the right, that's the goal. A proactive approach, where early detection gives everyone clarity and a sense of control. It's about moving from crisis management to thoughtful preparation.
And at the absolute center of this new approach is dignity. This quote says it all, really. Talk to me. I am the person who needs to know first. It's just such a powerful reminder to always keep the person, not the disease, at the front and center of every single conversation.
Okay, so let's get into what I think is the most empowering part of all this. This report isn't just for doctors. It lays out really clear, practical steps for patients and families. This is what you can do. The big takeaway here is to be proactive. That means talking to your doctor about any concerns, no matter how small they might seem. And, just as important, it means talking to each other. Discuss and write down end-of-life wishes. Have those tough conversations about potential hospital stays before they ever happen, and get connected with community resources that can help. These are all things you can do right now to take back a little bit of control.
And I love this. Here is a wonderfully simple and powerful idea from the report. A hospital visit can be so confusing and stressful. Just having a to-go bag ready with all the essentials, insurance cards, medication lists, your advance directive, and even comforting things like music, it can make a world of difference in a crisis. It's such a small act of preparation, but it can provide so much peace of mind.
And that really brings us to the final thought here. We have the data, we know the scale of the crisis,
and we have a practical, compassionate roadmap for how to navigate it. The challenge now, really, is for all of us. How do we take a blueprint like this one and make sure it becomes the standard of care, not the exception, for every single family everywhere that's facing this journey?